Welcome to yet another session with Marrow. This is a session which you all know where the toppers talk. Now, and this time we have with us none other than Dr. Anurag Anupam, who secured rank 7 in the recent SS exam. Let me welcome you, Dr. Anurag, to this topper session, the toppers talk. First of all, hearty congratulations to your achievements in this year. Commendable achievement. And rank 7 is rank 3, rank 2 is just a matter of semantics. Congratulations.
Thank you so much. Thank you for having me here. Thank you.
You must be over the moon and your parents will be so proud of you. Again, from all the team of Marrow, congratulations again.
Thank you.
So before we go really deep in this interview, if you don't mind, would you mind telling us a little bit about yourself?
Yeah, I'm Dr. Anurag Anupam. I have done my MBBS from MKCG Medical College, Berhampur, Odisha. And I've done my MD Medicine from AIIMS Bhubaneswar in Odisha.
Okay, and you finished the MD Medicine in? When did you finish your medicine, MD?
MD Medicine was in August 2023.
Okay. So let's start off the journey you had from 2023, August 2023, and 26th of April 2025, when the results are announced. Tell us.
Yeah, it was a little bit topsy-turvy actually. After I finished my MD, just during that phase, I actually developed a complicated pleural effusion. And I had continuous fever for around 3-4 months. It was a very tough time. I did appear for my NEET SS examination. I ended up with a half-decent rank, around 490 something rank was there. But I could not take any seat because my health was still not up to the mark. So, around 2 months after that exam also, I was still having fever and a lot of symptoms. So yeah, that was a bit of a problem.
Oh, that's a very, it's a fighter's story rather. This is yours is a fighter's story. It's a pretty impressive story. And I'm glad that you kept on at it. And despite you having fever, you wrote the exam. That shows you commitment, significant commitment. And that shows that you really wanted this seat. You really wanted to go further and do a DM. That is probably the one thing which I would underline in your case, that you really wanted it. The desire probably led you to be this. And in a way, it's great that you couldn't take up the seat last year, because this year you've got the seat of your choice. All this is open for you. It's up to you to choose. That is great. So let me ask you, which subject do you want?
I'm interested in rheumatology.
Rheumatology. Any other choices? I mean, now you don't have to, but probably last year you would have to think of choices as well. Second options.
Second one will be probably cardiology.
Cardiology and rheumatology. Great. That is great. So why rheumatology?
The thing is, sir, before actually joining MD, I had very little exposure to rheumatology cases. So when I joined MD Medicine in AIIMS Bhubaneswar, this was one of the new things for me. So we had some very good faculty there. We had Dr. Rajesh, one of our faculty was there. He's in some other AIIMS right now, but he had a fellowship in rheumatology. So there was a very large collection of cases from all sort of cases, from connective tissue disorders, vasculitides and all. So to see those cases, to learn about all of that was very interesting. And my HOD actually also started a rheumatology clinic as we went ahead. On Fridays, we used to have only rheumatic patients, around 20 patients in the clinic. So exposure to all that was definitely one of the reasons that I developed an interest. We did go to some quizzes and all. We ended up winning a few quizzes. So that stimulated the interest.
That is brilliant. So how did you prepare this time for rheumatology? I mean, rheumatology, considering, you have to understand that this is one of the most coveted seats in the country, and you have to be the best to get it. So how did you prepare? What was your mindset while preparing?
Actually, this is obviously all the subjects, entire medicine preparation is there. So I did have a little bit of paucity of time because I'm in some difficult circumstances right now. My mom is not very well. She's on palliative leave. So I was working outside. I did take a break of around 15 days. I had been studying whatever little time I was getting in the last 3-4 months. I was studying a little bit. 15 days I did actually just completely focus and study as much as I could. And the fact that I was always in touch, I was seeing patients consistently. So that made it kind of easy. Because 3 months back, I was like thinking I probably will not take DM at all. I will probably not appear the exam also. But my mom responded very well to treatment. She's doing very well, and that has been a big factor. That's something that has spurred me on, and I decided to just go ahead with it. 3 months back, I was probably not even thinking of appearing this exam.
Wow, that is seriously a story of fortunes and survivor and fearlessness. It's amazing. It's amazing. What you've done is commendable and brilliant. And I think you never let your goal. Your goal was always on your sights, despite the whole thing. Probably that is the reason why you managed this, man. It's commendable, brilliant. You are probably one of very few individuals who would have done this. So great, commendable. Any since you went through so many things at the same time, any advice to your people who going to come after you? How to go about this? Because for you, it literally has been a chaotic journey. The last 2 years literally has been full of chaos, but still you managed to wade the chaos and finally reach a place that you wanted to. So, see, we all know that the resources to prepare are always there. What each student lacks is the way to prepare and how to go about it. Because resources are there. All you have to use is how to utilize the resources and how to keep the mindset positive and how to deal with it in a very positive way. So, what advice do you have to give?
I think if you love something and if you are really committed to it, you will definitely find a way of doing it. I mean, if you are genuinely interested in a subject, if you genuinely want to pursue it, you will definitely find a way, despite of all the obstacles and all. I think if you keep going, if you are honest, if you're honest with your own purpose, you keep working, whatever time you get, if you are honest with yourself, you give whatever time is available, then I think things will figure themselves out. I think Almighty is there and things will definitely figure themselves out.
That is a brilliant piece of advice. It's a great piece of advice because being true to yourself and sincerity, integrity, honesty, and all these things, if you notice, it is kind of slipping away from our current generation. And we have come into a generation of YOLO, you only live once kind of generation. But this part of integrity and honesty and sincerity to yourself, I think that's what underlines your path through all the chaotic events that happen. Now, that is the crux of it. But now let's go to the other part of it. What do you say about the resources? How did you utilize the resources?
My association with Marrow has been pretty long. Like it has been since the NEET PG days, like 5-6 years now. You are seeing me for the first time, but if I see you, you are very familiar to me. I listen to you all the time. I see you all the time. I've learned so much from all you people. So there is a sense of familiarity with Marrow. And it's been a long journey. And it has been a source of not just preparing for an examination, but learning medicine in general. So, yeah, definitely. Marrow has been a big part of my journey.
How would you utilize the app? Or how do you utilize Marrow? As in,
I think I took Marrow around in the second year of medicine. At the end of MD, first year of MD medicine, and ever since, whenever I'm reading something, whenever I'm seeing a patient, I do come back home and watch the videos. Because we have a very hectic residency, so going back to the books and reading things line by line is probably not possible. We are always reading on the go, sometimes from Marrow, sometimes from Up to Date. So just reading the recommendations of various societies. So that's more like how we study. Even just before the exam also, we get not that much time to just sit and study. So that has been fantastic. Actually, Marrow has been an amazing resource.
And what about the question banks and the revision videos? How did you manage to go around that?
Yeah,
Was there
probably.
what I meant to ask, was there a day of the week where you did dedicated to the question bank, something like that?
No, I used to just keep doing question banks on and off. Like if I studied something, I will do it. Eventually, I try to finish as much as I can. It's a very, very vast question bank. So probably covering all of it is not possible. Majority of the topics, at least the important topics, the high topics that are likely to be asked, at least those videos and those question banks are definitely something you must focus on.
Okay, and the new revision videos also have been quite helpful.
Absolutely. Those are very, very good. Actually, for last minute revision, you may not be able to go through the entire playlist of videos. So that does come in very, very handy.
What about textbooks?
Yeah, certain topics you do go back and study from the textbooks. If you want some clarity on some concept and all, definitely it's necessary.
How do you decide?
That's the probably what you rely on is your grant tests and your question banks. Suppose you're doing a grant test or you're doing a question bank, you're getting a lot of questions wrong from a particular topic. Then that definitely means that there is some lack of clarity on that subject. So you need to go back to your textbooks, clear your concepts, watch the video if necessary, and you need to go and redress your problems on that.
Okay, so textbook has been as what you call it, it's a resource that has been kept behind only for as in no cover to cover, but for clarification.
No. Cover to cover as much as we could, we did during our MD time. But after that, it's a little schoolboyish to go and read everything from textbook. It's more like case-based learning and referring things.
Exactly.
For reference.
Yeah, that's good.
Reading guidelines.
I think they should, the youngsters should understand that, going back to back, cover to cover is not, it's not a good use of your time. It's actually a very inefficient use of your time. That is something which I would like to highlight here. Okay, with any now that it's almost around 15-20 minutes, let's wrap the interview up. What would you like to contribute anything? As in how, as with respect to Marrow, do you want to give any suggestions to us how to go about it?
I think the course material is quite vast, and with the addition of the revision videos, it caters to almost all the needs of the candidates. I think it's up to the candidates to be a little smart and use it according to the time frame they find themselves in. Actually, if you have only 3 months' time, obviously you cannot go back and watch the entire videos. You probably will have to stick to the question bank, go to the revision videos and all, or browse through the e-notes that are provided in the app. I think that would be a better strategy. But if you're in your second year of your medicine or your first year of medicine, obviously you should go and watch all the lectures, do as many question banks as possible. That will be absolutely fine. I think that's the way to go. Depends on what kind of situation or predicament you find yourself in. That will decide.
And what do you mean? Since you were working also before, during the preparation, you were working outside as well. So did you find Marrow as a reliable resource for referring when you're seeing clinical patients on day-to-day basis?
Absolutely. It's not a new phenomenon. It's not that I started it now. Right from my MBBS days, during internship, during my MD, Marrow has been a constant source actually for referring and finding out what's the right treatment or how do you approach a case. So that is something that's always been there. It's not now. It's always been there for the last 5 years.
Okay, that's great. Any special mentions from the Marrow faculty? Apart from, of course, that of Rakesh.
Yeah, the thing is, many generation of MD medicine doctors have actually learned from Dr. Rakesh, when Marrow began and all. So we are very, very deeply indebted to him for inculcating the right mindset in terms of how you approach medicine, how you treat patients. So definitely he's there. All our SS faculties have been absolutely brilliant. As I was telling you, I've studied your entire hepatology course. I've done all the videos. I've almost done most of the important question papers I've done. I've gone through the notes. Vaishak Renuji sir from neurology has been fantastic. Mayur sir, endocrinology. All faculty actually. Rheumatology, again, Rakesh sir is teaching. So that is something I've been used to right from the beginning. Everything, nephrology, Rakesh sir again. So, yeah.
That's great. So let's wind up this session with Topper's talk. And basically to underline the whole thing, what I understand is what I've been always discussing and whenever this interview happens, whenever this talk happens, is decide fast, decide first, and commit to it, and be true to yourself. You'll get it.
Absolutely.
So things, life may throw a lot of googlies in your way, but then if you're true to yourself and if you have the wants, as Dr. Anurag clearly demonstrated, we can get this. It's a great, I believe this is one of the good interviews I've done, and I hope people who see this get certain values out of this, and they are more positive in approaching the exam and not negative. Whenever we think of exams, you always have a negative connotation in our head. Exams will happen. But I hope that this will give you a more positive outlook towards the exam, especially this exam, so that you can achieve what you actually have the potential. Thank you for joining us. Thanks again. Once again, congratulations for your great achievement. I hope we'll meet again in the future somewhere, some conferences sometime.
Sure. Thank you.
All the best. Thank you. Bye-bye. Thank you.